day, 43 children will be diagnosed with cancer. 1 out of 8 children diagnosed with cancer will lose their battle. These raw, blunt facts about pediatric cancer seem disappointing for the ever-booming technology-filled world we live in today. One would think we might have something close to a cure, but the sad reality is only 3 cancer medications in the past 20 years have been specifically approved for children.
Cancer is a multi-layered, twisted, complex demon that is difficult to wrap the mind around. Hearing a diagnosis of cancer is earth-shattering, not only for the patient, but for every mother, father, sibling, and loved one. Trying to comprehend the path that lies ahead and the abstractness of this demon is not a simple task, especially for a young child. Having just learned how to tie shoelaces and write the alphabet, how can a little kid grasp such a dark and seemingly impossible diagnosis? This is the question that seems to be deemed the least important in the treatment of pediatric cancer, and it is the question we decided deserved the most attention throughout our research.
Generally, it would be thought that the mental state of a young child recently delivered a seemingly grown-up diagnosis of cancer would be a very fragile one. And because of this, it was decided that researching more in depth about pediatric patients' mental health should be a main focus. However, it was surprising to learn that children might handle their diagnosis more maturely than their parents.
In an interview with Dr. Charles Emeraldi, the chief ENT surgeon at Nationwide Children's Hospital, he stated, "They are very resilient. They're tougher than many people, even their parents, give them credit for. It depends on the age, but for most children, they cannot understand what it means to be sick. They have probably been ill their whole lives, so for them, it's normal to always feel sick. And they cannot think about their illnesses complexly, so all they really know is if it hurts or not."
But around the ages of 9 or 10 years old, something changes. Kids will begin to actually understand their diagnosis and the severity of them because they can think about their illnesses in more complex ways. It is at the age they begin to think deeper than it hurts, doesn't hurt. This can be a very difficult time, especially for cancer patients. As time progresses and treatment continues, they become different kids. They become socially detached and they have a difficult time relating to their peers.
In an interview with Dr. Smith-Patel, who is a child psychologist, she stated, "Children at this age with these diagnoses can suffer from many things, including depression, anxiety, separation anxiety, excessive worrying, fear, anger, guilt, and social withdrawal. Preteens don't yet have the necessary coping mechanisms they need to properly come to terms with their realities. As a repercussion of this, children may become angry at their parents or doctors for not being able to cure their illnesses. This anger may lead to acting out behaviors. They may react strongly against pampering or other attention due to emphasizing their differences between them and other kids. They may be unhappy, more emotional, or even withdrawn. They may refuse certain treatments or procedures, and they might even refuse to take prescribed medicine or lie about taking it. On top of this, it is possible that sick kids don't learn some of the necessary social skills because they receive less feedback about inappropriate behavior than healthy kids. And seeing as this is a time in a child's life that social and emotional development are very important, it is important to seek counsel from professionals and learn coping methods that could help your child. Dr. Patel recommended learn as much as possible about their specific illness and ask questions about procedures and treatments. Develop a hobby or activity that would be good to engage in during hospitalizations or waiting time at appointments. These include building things, puzzles, reading, learning a foreign language, or art. Also, continue to maintain contact with previous friends or classmates. Get involved in hospital activities or groups that are geared towards kids with similar diagnoses.
Okay. Another factor that plays a role in affecting the mental health of these young patients is hospital stays. Depending on the diagnosis and the treatment plan, hospital stays can be as short as a day or as long as weeks at a time. And the repercussions of these elongated hospital stays can be severe, as children can feel lonely and isolated. They feel different from their peers. They may have a hard time relating to their peers and may have difficulties forming lasting relationships.
Taking all of these factors into consideration, our first plan of action was to create some kind of program to help young cancer patients and their families escape their diagnoses for a little while. Talking with Dr. Almaraghi, he explained there are many different programs and charity events set up for the same reasons. To name a few, there is a program called Child Life at Nationwide, and this program gives kids a tour of the hospital and a kind of dry run of what it will be like when they stay there. There are also social workers and religious counsel. There's also a camp called Flying Horse Farms, which is a camp cancer patients and their families can attend, fully funded through philanthropy.
After speaking with Dr. El-Maraghi about the availability of support groups and researching the many different websites and other sources that are readily accessible for parents who have children affected by pediatric cancer, we came to the conclusion that there is not a huge need for yet another program that would be, in essence, be contributing the same information and programs one could find anywhere else. We did come across a startling finding. However, after all the research and speaking with multiple experts in the field, we did not find one single resource geared toward helping young kids actually understanding what their diagnoses mean. There are plenty of articles for parents juggling all the struggles of having a child who is battling cancer, and there are plenty of support groups for kids who have been diagnosed. To help them see there are other kids just like them, and doctors give parents all the information they need about their child's diagnosis, but there's nothing out there specifically made to help a young child understand their illness and what is going on to happen to them as they battle it. This is where our action begins.
Children need to understand to some degree what is going to happen to them throughout their battle against cancer. Dr. El-Maraghi told us that it is left up to the parents to decide how they want to deliver the news, but he never fails to tell his patients' parents to never lie to their kids about diagnoses or treatments. Preteen children should be aware of what's going on and what their body will be put through, and the repercussions they will face as a result of the treatment that they undergo. As children mature, it is easier for them to grasp their realities. But for a child who is 6 years old, which is the average age of a child diagnosed with pediatric cancer, it is a much more difficult task to try and explain what is happening to them.
There are some basic children's picture books that explain the doctor's office and even basically the hospital. But there aren't really any educational resources out there for a kindergarten patient who will be undergoing surgery to remove a tumor. This is our goal. Create a picture book at a kindergarten reading level explaining in the most basic of terms what will happen throughout this process. We will work alongside Dr. El-Maraghi and Nationwide Children's Hospital to create a book that the hospital can give to little cancer patients so they can, on some level, grasp what is happening, why they feel sick, and how the doctors at Nationwide are going to help he or she feel better.
And here is a look at our book. There are so many outlets for support and help for children affected by pediatric cancer and for their families. There are millions of dollars being funneled into research for finding a cure. Strangers come together at charity events to raise money in hopes of lowering the number of children diagnosed every day from 43 a day to 0. Top-of-the-line technology is being invented for more cutting-edge procedures to help save more lives. Hospitals paint pretty pictures on the walls of the corridors and put stuffed animals in elevators to try and make the hospital seem like less of a scary place. But at the end of the day, the cure is not here yet. Thousands and thousands of young children are battling cancer each day. So while they wait on a cure, we need to find ways to make these warrior kids as comfortable and educated about their daunting diagnoses as possible. We hope this book about pediatric cancer and surgery is a way we can enact this change.
That's gonna be a bitch to edit.
We can try it one more time if you want.
Nope,
You want to see?
I am done.
Why? We can just see.